Okay. What else did I want to tell you about that? If they can do, yeah, okay, I did tell you about that. The resisted movements. Okay, so for flexion, I would like you to flex your elbow. I'm going to provide some resistance. So I'd hang on to the elbow here, and I would push down. Okay, any pain there? Oh, good. Okay, I'd like you to push down with your arm, and I'm going to pull up. Any pain? Nope. Good. Okay. Same thing, that politician's handshake, right? I'd like you to, I'm just going to show you the motion. I'd like you to put your palms up. I'm going to provide some resistance. Okay? Any pain there? Okay. I'd like you to try and put your palm down. I'm going to provide resistance. Any pain there? Oh. Okay, you remember with isometric contractions, you don't want that joint moving, right? You just want...
I feel it more in my wrist.
Yeah. And make sure you tell them this is not a strength test, right? I just want to see if there is some pain or some weakness when I provide some resistance. I've had some guy and I was like, oh, wasn't ready for that. Okay, so I'm going to provide a little bit of resistance and you try and bring it up and your arm up. There, okay? I'm going to provide a little bit of resistance, you try and push down. Yeah. So you know that it's not a muscle versus muscle kind of test. With your resisted tests, because the muscles in the forearm, the flexors and the extensors are affected, right? The extensors to the lateral epicondyle, the flexors to the medial epicondyle. You also want to test their wrist flexion and wrist extension with resisted movement, okay? So what I usually do is use a chair and then have them put their arm outstretched. So we'll use the other arm. Yeah. So arm is out. Are you gonna? Am I gonna be in your way?
No, this should be good.
Okay. Okay. So with your hand like this, right up there. Okay, you want to be above the joint and below the joint. Okay. I'd like you to try and push your hand up. Okay. I'd like you to try and push your hand down. Okay. Very little movement, very little resistance, but this is testing the flexors and the extensors. Okay, so the extensors, the flexors.
There's more to do with the wrist?
The wrist, and more to do with the attachments of those muscles, the lateral and medial epicondyle. Okay. Okay, so let's go into the special tests. So if you want to lay on your back on a bed here, come on around. So with these special tests, they give you more specific clues to what's going on with the elbow joint, and you want to make sure that they're telling you about the pain, okay? And you want to be very careful and gentle with them. You will also be feeling with some of these tests excessive movement or not, okay? So for the traction, arms, I would say abducted about 30 degrees. Doesn't have to be so specific. So I would put one hand above the joint, one hand below the joint, and I'm providing traction, okay? So I'm basically just pulling using both hands, and if you can just picture, okay, this joint, if there is actually a joint problem, this traction may actually feel better. So there's another clue. So hand above the joint and below. If it feels worse, it could actually be a ligament problem. Now, you want to do the traction on flexion, so have them put their hand, okay, so they want to be nice and loosey-goosey, on your shoulder. You need to get down. You also need to think about yourself and your positioning too, okay? This table is way too low for me. I basically have to do a full squat or get down on my knees, okay? And, are you comfortable? Mm-hmm. Okay, I'm just going to give it a pull. So, hand above, both hands, and her hand on my shoulder, so she's relaxed, and I'm pulling in the direction. Okay, good. So that's traction.
What does that test for that's different than the in extension?
That's the question I have for Jackie. It's going to give you a different angle, so it's going to give you something more specific. So write that one down too. She was just so running through all the tests. Yeah, you got it. Yeah, and then I didn't go on and say, so why? So compression, same thing. We're going to do compression in full extension and then compression in 90-degree flexion. So one hand above, one hand below the elbow, and you're basically just pushing, okay? Pushing that joint together. If there's a joint problem, what do you think?
Pain.
Yeah, there's going to be pain.
Sharp shooting pain.
Yes. So if the joint surfaces are messed up, inflamed, yeah, that's
Or
going
if
to be
there's stuff in
painful.
between there that's inflamed.
Yes. So again, I'm going to do the compression. With this one, you need to put your hand on their shoulder, okay? Because if I'm giving her compression, she's going to be moving her shoulder here. Okay, so hand on the top, other hand right at the base of the olecranon, and then you just push. Okay, you're good? All right. So the varus and valgus tests, these ones test the medial and lateral epicondyles, or epicondyles. I just did surface anatomy, so the medial collateral ligament and the lateral collateral ligament. So this one, you want to make sure you can take their arm up so it meets you, okay? So you need to be comfortable. You want to make sure that the elbow is extended though, so straight. All right. So what I'm going to do is I'm going to do the valgus force first. All right. So I just want to make sure my hands are exact. Yeah. Okay. So I'm going to use my hips too. My inside hand is going to be below the elbow joint. My outside hand here is going to, or my up hand, most proximal hand is going to be above the elbow joint. I'm just going to use, I'm going to push here and I'm going to hold here, kind of lock it in with my hip. Does that make sense? So I'm testing the medial collateral ligament. Okay. Here, I'm going to come inside now and use my hips. Now I want to test the lateral collateral ligament. So I'm keeping this elbow straight, kind of locking it into my hips and pushing out. Pushing. Does that make sense? See that? Okay, so that's the lateral collateral. Good, thanks.
So there was a click on the medial side when you did it. I'm not sure if it came from my wrist or if it came from, I'm not sure if you felt that.
Wait a minute,
There's-
tendon
there's
just
a bit of
clicking
a
over,
click,
right?
Yeah, there was a click
Yeah.
in there.
I'm so nervous about being on the YouTube thing. I'm just going through the motions.
But it could be from some, because I do have issues with my arms. So,
Yeah,
yeah.
and it could be, the clicking, right? That
Yeah.
it could be the tendon just flipping over the
Yeah.
bony protrusions, right? Could be, yeah. Okay, so this next one is a stress test for the annular ligament. Okay, so do you guys remember the head of the radius? Do you remember how to find that? Lateral. So you find the lateral epicondyle, then you go distal, just distal, and you're going to find the head of the radius. Okay, so there. Okay, so find that head of the radius. Then you're going to do, lung 5. Where lung 5 is. Okay, you're going to go in there. I like using this hand better. So stabilize the arm. Put your forefinger on the head of the radius. Go just lateral to the lung 5, and you're going to have to go deep. So this is where you need to talk. Okay, go deep through that tissue, and you're going to get to the anterior portion of the head of the radius. And you're going to go up and down. You feel me kind of moving that? There shouldn't be a whole lot of movement. If it's excessive in there, then that's testing a lax annular ligament. Okay, so find the lateral condyle, go just distal, go just lateral to lung 5, get in that meaty tissue and dig, and you're going to feel it. It'll come to your thumb. And then just push down and pull up. There's no laxity there. And then you may want to compare it on the other side. So if you feel a little bit of laxity and go, oh, is this normal? Go on to the other side and check that out too. Okie dokie. It's hot here.